Thank you so much, Dr. Vivek Virendra Singh, for joining us today as we celebrate World Immunization Week. What role has immunization played over the years in saving lives?
Ambika, my pleasure to be on the show. Immunization and safe water and sanitation are two simple yet leading global health interventions which have added to the longevity of the populations. Modern medicine can add only a few years to lives, but not at the population level. I'll give you two figures. Every minute, vaccines save life of 5 children. And vaccines save life of 2 to 3 million children, just children each year. And for a period of 2000 to 2030, a study has shown that for 12 diseases for which vaccines are available, 92 million lives would be saved for these 3 decades. And just for children, 52 million lives, which is 5.2 crore children across the globe, will be able to live in these 3 decades because of the availability of vaccines.
So, that is the importance of vaccines. Dr. Singh, if we look at the NFHS 5 data, the numbers of people taking the essential, children specifically, of vaccines has improved quite a bit. Going forward, what steps do you think we should ensure that every child gets vaccinated and to ensure that no one is left behind, especially the tribal communities, when we talk about the rural areas, the remote areas, so that last mile connectivity is seen and every child is vaccinated?
That's a very important point, Ambika. And as on date, in today's times, where there is political will, where there are resources, when there is availability of good quality vaccines, especially in a country like India, for us, what is important is that now the focus should not be on celebrating those who are already reached, but rather reaching those that are unreached. And it is very important for us to understand that it is not acceptable in today's times for any child to have missed on the vaccines, either an antigen or throughout their first year at least, which we call the full immunization coverage. So all of us need to come together to ensure with every child.
Thank you so much, Dr. Singh, for joining us.